Hi, I'm Stephanie Larson, and I've been a birth professional for more than 20 years. Sometimes babies come more quickly than you'd expect, or they come before you've gotten to your place of birth. So if that happens, don't worry. Remember that birth is a normal life event and that you and your baby have birth instincts, so you really know just what to do. Stay calm and take nice deep breaths. This is going to send oxygenated blood to your baby. It will help you stay calm, and it also helps your muscles work most effectively. When you feel the baby coming, you should have some support. So a tree is a good thing. You can put your back against a tree or a wall, or in this case, I'll show you a corner for support. You want to make sure that you have something soft underneath you, like clothing or a blanket, or even grass. So now I'm using the corner for support, and I've got my pelvis against the corner. This leaves me not working very hard with my legs at all, and I have my hands free. So as I feel the baby start to come out, I can support the baby with both of my hands. And I feel right now the baby's head is coming out, so I'm gently supporting baby's head and baby's neck. Never want to pull the baby out, just hold the baby while the baby comes. And if you feel like part of the baby, the head has come out, but the shoulders aren't coming, you can always just move your hips or even move your leg to allow the rest of the baby to come out. So now the baby's coming out, I'm gently supporting the baby, and I can bring the baby up to my body. I want to dry the baby off because it's important for the baby to get dry and then stay warm. So let's imagine now that I've put the baby under my shirt, baby's skin is against my skin, and that's keeping the baby warm. And I'm also going to support the baby underneath their bottom and behind their neck and allow them to find their way to the nipple so that they can start to latch on. Ideally, it's great if baby can start to breastfeed in the first 30 minutes. The next thing that happens is that the placenta will come out. So that will happen on its own, and it may take some minutes after the baby has come out. We don't want to yank on the cord to get the placenta to come out. That will happen on its own. Once the placenta comes out, you can put it in a bowl or a container or set it on the ground. You want to hold on to it because your care provider will want to inspect it and make sure that it's all in one piece and nothing has been retained inside of your uterus. Now, the cord is still attached to the baby at this point, and we don't have to cut the cord. You can wait on that. In fact, you could wait several days until the cord falls off naturally. But if you'd like to cut it, make sure you wait until the cord has stopped pulsing. You can even wait until after the placenta has been born. And then you want to go several inches away from the baby's body and clamp the cord in two places. You can use a shoelace to tie the cord off in two places. And then don't cut the cord until you have something sterile that you can cut it with. You can use scissors. Just sterilize them first with boiling water or by burning it, and then make sure it's cool before you cut the cord. And that's your quick guide. To learn more about giving birth, go to dancingforbirth.com and find a weekly Dancing for Birth class near you.